Okay, so today's lesson is about the thorax, the regional anatomy and cross-sectional anatomy of the thorax. So you should, in the end of the course, you should be able to identify the component parts of the thorax and relate their knowledge with the radiological anatomy of the thorax. So not only during this lecture, during the practical sessions and through self-studying, you should try to achieve these outcomes. So when you look at the thorax, it is an irregular cylinder in shape. You can see that it's the upper part of the torso, upper part of the body, and it is roughly a cylinder in shape. And its upper end is open into the neck. And there are structures passing between the neck and the thorax through this aperture, through this opening, which is called the superior thoracic aperture. And if you take the inferior end, the lower end, it is covered by a muscle called the diaphragm. This is the diaphragm. So you can see the lower end is covered by the diaphragm, but there are some structures passing through it. There are few openings through the diaphragm, and some structures pass from thorax to the abdomen through those openings. So again, we have a picture of the superior thoracic aperture or the thoracic inlet, where the thorax opens into the neck. You can see blood vessels and some nerves, and then you have the trachea, and here the esophagus passing from the neck into the thorax. And this is a much clearer diagram of the diaphragm. You can see it has like two domes on the right side and the left side. And you can see the openings. There's one opening for the esophagus and for the inferior vena cava here. And more posteriorly, you have the aorta passing behind the diaphragm. If we look at the skeletal framework, the bones which make up the thorax, you have the vertebral column here. The thoracic vertebrae. There are actually 12 thoracic vertebrae which make up the thorax. So from each of these 12 thoracic vertebrae, you have ribs coming out. These are the ribs. Okay. Okay, so this is the anterior view. You can see the vertebral column, the ribs arising from the thoracic vertebrae. And here you have a piece of cartilage called the costal cartilage, which joins the ribs to the sternum. This is the sternum. This bone here is called the sternum. It can be divided into three parts again: the manubrium, the sternal body, and the xiphoid processus. And so this is the anterior view, and this is the lateral view. You can see the vertebral column here, and the ribs, they pass downward. Usually they pass downward anteriorly to join the sternum. And this is the posterior view. You can see the ribs are articulating with the vertebral column. Here, this is a typical thoracic vertebrae. So the vertebrae, you have the cervical vertebrae in the neck, then the thoracic vertebrae in the thorax area, then the lumbar and the sacral in the much lower regions. So they have typical appearances. You will learn about each of those in these sections, but usually the thoracic vertebra is considered as a typical vertebra, and this is one of the typical thoracic vertebrae. You have a vertebral body here. Then you have some processes. Posteriorly, you have the spinous process. This is the spinous process, and on either side you have two transverse processes. These are the transverse processes. And joining this spinous process and the transverse process, this part is called the lamina, and this part which joins the body to the transverse process is called the pedicle. And you have a space, the vertebral foramen, through which the spinal cord travels. This is the lateral view. You can see the vertebral body, the transverse process, and the spinous process. So there are some areas which articulate with other bones. So these areas articulate with the ribs. And this area, it's called the superior articular process. It joins with the upper vertebra. So this is the inferior articular process. So if you take the vertebra below this, the superior articular process of that vertebrae joins with the inferior articular process of this vertebrae. Here you have a typical rib. So there's a head, a neck, and a shaft. This is the shaft, and you have an angle in this region where it curves forward. So you can see the internal surface, the external surface, and there's a small groove in the inferior region where the blood vessels and the nerves travel. So these are the places where the rib articulates with the vertebrae, where the rib joins the vertebrae. So this is a clearer view of the sternum. You can see the three parts clearly here. You can see the manubrium, then the body of the sternum, and the xiphoid process. So the costal cartilages coming from the ribs join these areas. So this is how a vertebrae is joined to a rib in this way. And here, through the costal cartilage, it joins the sternum. So that way we find the skeletal framework of the thorax. Now when we consider the thorax, when we come inside the thorax, it can be divided into few compartments. You have the right pleural cavity, the left pleural cavity, and in between them you have the mediastinum. This middle area is the mediastinum. This is a cross section. If you cut through this, through a line like this, you can see this view. You have the right pleural cavity, left pleural cavity, and the mediastinum in the middle. So this, so here we will look at the pleural cavity. Okay, so the pleural cavity contains the pleura and the lungs. Superiorly, it extends a bit above the first rib into the neck, and inferiorly, it lies on the diaphragm, just above the costal margin. So the costal margin is this line, right? So this is the costal margin, the lower edge, and the diaphragm is attached to that. And the pleural cavity extends up to that level. Okay, so on the medial side, you have the mediastinum. So it's bound by the mediastinum in the medial aspect, the thoracic wall on the lateral aspect. Below you have the diaphragm, and superiorly it extends just above the first rib. Then if we look at the pleural cavity, it is more exteriorly you have the pleura, right? So pleura, you have two layers. The parietal pleura, which lines the thoracic wall. The thoracic wall in the outer aspect. And then inferiorly, you have the diaphragmatic surface and the mediastinal surface. So these areas, externally, you have the parietal pleura. And lining the lung, you have the visceral pleura. So the visceral pleura closely adheres to the lung, and it also goes into the fissures also, like this. And this parietal pleura is continuous with the visceral pleura. You can see here, it continues with the visceral pleura. So this area is called the hilum of the lung. At the hilum of the lung, where at this place, the blood vessels and the airways enter the lung. So at this place, the visceral pleura is continuous with the parietal pleura. And in between these pleural layers, you have a small cavity. It's called the pleural cavity, and it's a potential space. Usually these are close together with a very thin layer of fluid, but it has the capacity to expand if there's any other substance entering this space, like for example air or pus or blood, anything, this space can expand. When we take the parietal pleura, which is the external layer, there are several parts to it. You have the costal part, which is close to the thoracic wall, to the ribs, these intercostal spaces, and this area, this is called the costal surface. And the part which is next to the diaphragm is called the diaphragmatic part. And the part next to the mediastinum, adjacent to the mediastinum, is called the mediastinal part. And the part which extended above the first rib, this area is called the cervical part, and it extends a little bit into the neck. Then we will look at the root and the hilum. So this is the place where the visceral pleura is continuous with the parietal pleura. Here you can see this is the root where the airways, the bronchi, and the blood vessels, the pulmonary arteries and the pulmonary veins enter and leave the lung. So here it is covered by the a sleeve of pleura. So this is continuous with the parietal pleura, this layer. And below it has a small expansion. This is called the pulmonary ligament. So this allows expansion of these blood vessels and airways, and upward downward movement of the airways during breathing. So this is the pulmonary ligament. The hilum is the area of the lung where the root joins the lung. So if we look at the structures at the root, you have the bronchi here. These are the branches of the trachea. We will look at it later on. Okay, so this is the bronchi, which are the main branches of the trachea. And then you have the pulmonary arteries. Here are the pulmonary arteries. Then you have the pulmonary veins. Here, these are the pulmonary veins. These return the oxygenated blood from the lung to the heart. And the pulmonary artery, it receives blood, deoxygenated blood from the heart to the lungs. Then there are other small blood vessels, the bronchial vessels, and small nerves. And you can also find lymphatics in this root. Then we'll talk about the pleural recesses. There are some places of the pleura which are in contact with the parietal pleura, which is in contact with the layer of parietal pleura without lung or visceral pleura in between. So if we consider this as the lung, you have the visceral pleura in contact with the lung. Then you have the parietal pleura. It is usually in direct contact with the visceral pleura, but in some areas there's a small space, like here and in this region. So this is the costodiaphragmatic recess. Here you can see clearly there's an expansion of the parietal pleura beyond the visceral pleura like this. And here you can see the, this one. This is the costo-mediastinal recess extending in front of the heart. So in this recess, it can be used to draw out pleural fluid, the fluid between the visceral pleura and the parietal pleura. You can use this space to draw out that fluid for various purposes, like for diagnosis of disease of the lung. You can draw out fluid from this space. Then we will look at the lungs. So here we see the right lung and the left lung. So the lung is the place where air exchange happens. So we already look at these vessels and the bronchi, right? If you look at the lungs, there are a few surfaces. So if you look at this right lung, this outward surface, it's not clearly shown here. This outward surface is the costal surface, right? So then you have the mediastinal surface in contact with the mediastinum, and then inferiorly you have the base or the diaphragmatic surface in contact with the diaphragm. And then you have the apex, which extends into the neck. So yeah, those are the basic surfaces. Then there are a few borders, actually 3 borders. So inferiorly, you have the inferior border, which separates the costal surface from the diaphragmatic surface. And here you have the anterior border. It separates the costal surface from the mediastinal surface. And these both inferior border and the anterior border are sharp. Then the other border is the posterior border. It is a bit round. So if you look at the rib cage, if this is the vertebrae, you have the ribs coming like this. And the posterior surface, this surface is in contact with this area around the angle of the ribs. So that surface is a bit round in shape. So when you take the right lung, it has 3 lobes, right? You have the superior or upper lobe, middle lobe, and inferior lobe. These are separated by 2 fissures. You have the oblique fissure going from this region, about 2.5 centimeters from the apex, to the antero-inferior area, like this. Then you have the horizontal fissure, which goes around at the level of the 4th rib horizontally. So here, this is the left lung. The left lung is a bit smaller because you have the heart extending into the left side of the thorax. So here you have a space you have for the heart, cardiac nodes. So therefore, the left lung is a bit smaller. So you have only the superior lobe and the inferior lobe, or the upper and lower lobes. And the superior lobe, this part extends in front of the heart, and it's called the lingula. It's a tongue-like extension of the upper lobe over the heart. So now we look at the bronchial tree. So bronchial tree is the extension of the airway, right? So if you look at a sagittal section like this, so you have the nasal cavity here, the nasopharynx here, the oropharynx here, and here you have the esophagus in this way, and here you have the larynx, and the larynx continues as the trachea. So this is the pathway where air travels from the external environment. So here from the cricoid cartilage, that is the cartilage of the larynx, you have the trachea. And here you have at about T4 level, the trachea divides into two branches. The main bronchi, or the primary bronchi. You have a right main bronchus and a left main bronchus. So the right main bronchus divides into three lobar branches because there are three lobes of the right lung. And in the left lung, you have two lobar branches, the upper lobe and the lower lobe. And then each of these lobar bronchi divide again into segmental bronchi. So each of these segmental bronchi supply a bronchopulmonary segment, and there are areas of the lung called bronchopulmonary segments. So each of these lobes are further divided into bronchopulmonary segments. See here, you don't have to know each the names and locations of these, but this is the upper lobe. You can see there it is divided into three parts. So each of these parts act as a single separate functional and anatomical location. So each of these have one segmented bronchi supplying them, one pulmonary artery branch, and the veins, they travel in between these lines, between the segments. So if there is a disease of one segment, it can be safely removed without damaging the other segments. So here we see some of the structures which are related to the lungs. So this is the right lung. Here you see the esophagus and the veins. You see the superior vena cava and the inferior vena cava, which brings blood from the body to the atrium. And these are branches of the superior vena cava. You can see the right brachiocephalic vein and the left one. So the right one is in contact with the right lung, and it again branches into the subclavian vein and internal jugular. Here you see the subclavian vein. And more posterior to the veins, you have the arteries. Here you see the subclavian artery. And there's another vein joining the superior vena cava, which drains the structures in the thorax. This one, it is the azygous vein. And there's the first rib also in contact with the right lung. In the left lung, also you have the esophagus, but a bit laterally and posteriorly, you have the aorta. You have the aortic arch here and the descending aorta. And you have the left brachiocephalic vein, which joins the superior vena cava here. And here you have the first rib. So this is a chest X-ray, right? The posterior anterior view of a chest X-ray. This is the normal chest X-ray taken of a person, right? So these are the lungs, right? Can someone tell me what color air is seen in an X-ray? What color do you see air? By looking at this picture? Yes, someone has typed black because air is typically has no density. So if this is the chest X-ray, so the X-rays travel like this. So they have no barrier, the places with a lot of air don't have much of barrier. So these are seen as black. And the bones, they are more dense. So those areas, there's the body is more. So you see as white color. So here you see the ribs. This is the vertebral canal. And here you have the trachea, right? Then the trachea bifurcates at around T4 level. And here you see the bronchial tree at the hilum of the lung. And you also have the blood vessels entering the lung here. You can see the pulmonary artery here. Here, this angle is called the costophrenic angle. Here, if you remember, you have the costodiaphragmatic recess, right? If there's fluid collections, you will see this place as filled with white color. And here, this angle is called the costocardiac angle. This is not the same as the costomediastinal recess because the costomediastinal recess extends in front of the heart, right? So if there's any pathology here, fluid collections around the heart, you can see this angle is obliterated. Yeah, others are these are the domes of the diaphragm. Right? And here I have shown you how you can identify the lobes. So here you have the right upper lobe, right, in this region. So this is the posterior anterior view. And if you look at it laterally, in this region, you have the upper lobe, right? And the middle lobe, it's like this. It starts from the posterior region and extends like a triangle, like this. And if you look at the posterior anterior view, you can see this lower part is the right middle lobe. And here you see the right lower lobe. So this right lower lobe, if you look at the posterior anterior view, it overlaps with the upper lobe and the middle lobe. In this upper region, it overlaps with the upper lobe. And this area, it overlaps with the middle lobe. So to differentiate pathologies of these areas, you have to look at the lateral view. So laterally, you can see the lower lobe extending like this. So these are the fissures, right? The oblique fissure and the horizontal fissure, which extends along the fourth rib here. And this starts from the upper posterior region and descends to the inferior region here. So this is a picture of the left lobe. So the left lobe, the left lung. The left lung has two lobes, the upper lobe and the lower lobe. Here you have the upper lobe, which extends like this. So it is seen on the posterior anterior view like this. And this is the lower lobe. You can see this is the lateral view. And in the anterior view, these areas overlap. Right? So you only have the oblique fissure here, extending like this. Okay, so between the pleural cavities, we had the mediastinum. This is the mediastinum between the lungs, right? It extends from the sternum here to the vertebrae, to the anterior aspect of the vertebrae, right? And from the superior thoracic aperture to the diaphragm. So here is the lateral view. This area is the diaphragm, the mediastinum, and it can be further categorized into subsections. You can classify it to the superior mediastinum and the inferior mediastinum. So if you draw a line, an imaginary line through the sternal angle here between this manubrium and the sternal body anteriorly, and posteriorly you have the L4, L5 level. That is the lower border of the fourth thoracic vertebrae. If you draw a line like this, you can divide the vertebral the mediastinum into superior mediastinum and inferior mediastinum. Okay, then if you look at the inferior mediastinum, it can again be divided into three parts depending on the pericardial cavity. So here you have the heart, and the covering of the heart is called the pericardium. So within this pericardium, you have the middle mediastinum, and anterior to the pericardium, you have the anterior mediastinum, and posteriorly, you have the posterior mediastinum. First, we will look at the middle mediastinum. It contains the main organ of the mediastinum, which is the heart. You have the heart, it's covering the pericardium, and you have the origin of the great vessels, the superior vena cava, the aorta, and the pulmonary arteries. Then you have some nerves, like the phrenic nerve and the vagus nerve. And then you have other small blood vessels, like the coronary arteries and the cardiac veins. If you look at the heart, again, it can be described in different surfaces. You have a base or the posterior surface, which is situated more posteriorly, right, in contact with the esophagus and the structures behind. So this is the base or the posterior surface. Then you have the diaphragmatic surface or the inferior surface, which is in contact with the diaphragm. Then you have the sternocostal surface or the anterior surface, which is in contact with the thoracic wall. Then you have the apex, the tip of the heart. Right? So even though the heart is there are 4 chambers of the heart, right? So even though the heart is drawn like this, the atria are situated posterior to the ventricles. So actually, if you have the atria like this, the ventricles are situated anteriorly like this. Right? So can you tell me what is the chamber of the heart which makes up the posterior surface or the base of the heart? What do you think is the chamber here? That is the posterior surface. Okay, someone has typed right and left atria. Okay, yes. So mainly the left atrium. So this is the left atrium. This is the left atrium. So from the left atrium, you have the pulmonary veins. Pulmonary veins join the left atrium. So it basically makes up most of the posterior surface, and you can consider a bit of the right atrium as well. Then what about the diaphragmatic or the inferior surface? What are the chambers making up the inferior surface? We have right ventricle and left ventricle as answers. So mainly it's the left ventricle here, and also a part of the right ventricle. Right? So this is the inferior surface. Then about the sternocostal surface or the anterior surface. Yes, mainly the right ventricle. And you also have the part of the left ventricle and the right atria, or this part is called the auricle. Then the apex is made out of the left ventricle. Here. Yes, the left ventricle makes up the apex. Then to describe the heart, we can describe the heart with margins. You have the right margin here, the left margin or the obtuse margin, and the inferior margin or the borders, right? So the right border you can see here, it's made of the right border contains the right atrium. The inferior border contains mainly the right ventricle. Then we have the apex here by the left ventricle and the obtuse margin again by the left ventricle. Then the pericardium, similar to the lungs being covered by the pleura, the heart is also covered by a layer called the pericardium. It is also a single cell layer. The pericardium has two parts, the fibrous pericardium and the serous pericardium. The fibrous pericardium is the most external layer. It is made out of connective tissue. And the serous pericardium is the layer made out of a thin layer of cells. So the serous pericardium again can be divided into two layers, the parietal layer, which is more external, and then in contact with the heart, you have the visceral layer. So this visceral layer is actually the outermost layer of the heart, called the epicardium, right? If you learn about the histology, you will learn that the heart has three layers. Do you know about them? What are the three layers of the heart muscle? The heart. Okay, fine. It's the endocardium, myocardium, and the epicardium. So if this is the internal surface, you have the endocardium. Then you have the myocardium and you have the epicardium. So this epicardium is the visceral layer of the serous pericardium. Then you have the parietal layer, which is continuous with the visceral layer, just like the pleura. And covering it, you have the fibrous pericardium. So what is this? Unmute yourselves and answer, or you can type. Yes, it's the right atrium. Here you have the right atrium. Here, in this region, which chamber of the heart? Left ventricle, yes. Then here, a bit posterior and superior to the left ventricle, left atrium. Yes, good. Then here, this is the aortic notch. It's made up of the aorta. And here you have the pulmonary vessels. And here it shows the superior vena cava. Okay, right? So here it's the superior vena cava. We have the right atrium, left ventricle, left atrium, left pulmonary artery, and the left aortic arch. So we have four structures in this margin. You should be able to identify the aortic arch, the left pulmonary artery, left atrium, and left ventricle. And on the right side, you have the right atrium mainly. You have the pulmonary vessels here and the superior vena cava. Next, we will look at the superior mediastinum. Right? So, superior mediastinum, it's the anterior margin is the sternal angle between the manubrium and the sternal body here. And posteriorly, you have the T4, T5 level, the inferior border of the T4. Okay. So here you have some major blood vessels and some other organs. Okay, so one of the organs is the thymus. Here is the thymus in front of the heart. This is not the thyroid gland, okay? Thyroid gland is situated in the neck. This is the thymus gland, What is the function of the thymus gland? Can anyone tell me? Yes, very good. Maturation of T cells. It's not an endocrine organ, it's an organ of the immune system. T cells are a type of white blood cells. That is the blood cells which act against invasive organisms, right? So there is a type of lymphocyte or white blood cells called T cells, and these T cells become mature in this organ called the thymus. So this thymus is very well organized in children, and as you come to puberty and as you grow old, this thymus will obliterate gradually. It will become less in size and will be replaced by fat tissue. So this is the thymus, and it is situated in the superior mediastinum, and it extends a bit into the anterior mediastinum as well, in front of the pericardium. Okay? So that's about the thymus. Then you have the veins. So coming from the heart, you have two major veins. The vena cava, the superior vena cava, and the inferior vena cava. A picture of the inferior. Here you can see to the right atrium you have two veins draining. From the superior aspect you have the superior vena cava, and the inferior aspect you have the inferior vena cava. This superior vena cava has two branches, the brachiocephalic veins. Right? So these are the two brachiocephalic veins, the right brachiocephalic vein and the left brachiocephalic vein. And these divide into branches, right? The subclavian vein and the internal jugular. Okay, so those are the main veins. And yes, the left superior intercostal vein is a smaller vein which drains into the superior vena cava around this region. And the arteries, you have the ascending. Sorry. Okay, here you can see the aorta. Actually, from this superior mediastinum, it becomes the arch of aorta. So if you take this as the T45 level, and this is the sternal angle, so you have the ascending aorta up to this level, and at this level you have the arch of aorta starting. Here the arch of aorta starts, and here it will end, and from there on you have the descending aorta. Okay, so the aorta can be divided into three main parts, right? The ascending aorta, the arch of aorta, and the descending or thoracic aorta. So the arch of aorta has three main branches. Okay, you have the brachiocephalic trunk to the right side. Then you have the left common carotid and the left subclavian. The brachiocephalic trunk also divides into two branches. The left subclavian, the right subclavian and the right common carotid arteries. Okay, so those are the main arteries, right? So from the descending aorta, you have many branches to the lungs and others, to the esophagus and structures of the thorax. Okay. So this is the part of the aorta in the superior mediastinum. Right? Arteries. Then you have the trachea and the esophagus posterior to the trachea. And you have some nerves, like the phrenic nerve, vagus nerve, and their branches. And lastly, you have the thoracic duct. Here, this is the thoracic duct. It drains the lymph of the body. Okay, so I hope you know what lymph are, right? Can someone tell me what's lymph? Extraintestinal fluid, yes. So when you have at the capillary level, blood vessels which start from the aorta, they become smaller as they reach the organs, and they divide into many branches. And at the organs, they become only one cell layer thick, and at these places, the fluid will come out, right? The blood, the exchange carbon dioxide, metabolic stuff and everything, the fluid within these blood vessels will come out to supply the surrounding areas, and they continue as veins, right? The capillaries get together to form venules, and they get together to form veins. So these are the veins, and some of the fluid re-enter these veins, but some remain outside. That's called the extracellular fluid. So this extracellular fluid which is left outside enters the lymph vessels. So lymph vessels starts from the organs of the body, and they bring this fluid back to the heart, right? So from the lower part of the body, they form this thoracic duct. So all lymph from all over the body enter this thoracic duct, and it is drained along this. It travels in the posterior mediastinum like this, and enters the superior mediastinum, and enters the veins like this at the junction of the internal jugular vein and the subclavian vein, and enters the brachycephalic trunk. The brachycephalic vein. Okay, so there are lymph nodes along these vessels, which have a lot of white blood cells. So that's why it becomes a part of the immune system. Okay, so the thoracic duct enters the left side of the body, and from the right side you have the right lymphatic duct. It is much smaller and drains the lymphatics of the right side of the body. Thoracic duct we covered. Trachea and esophagus, there's not much to add. Then the phrenic and the vagus nerves. So this is the phrenic nerve. It starts from the neck, the cervical level. Actually, the C3, C4 and C5 level, the phrenic nerve starts, and it supplies the diaphragm. Breathing movements are controlled by this phrenic nerve. And here, this is the vagus nerve. It starts from the brain stem actually, and it descends downwards like this. It has many supplies. It has a parasympathetic outflow, and it gives parasympathetic supply to the heart and the lungs in the thorax, and also the esophagus, the blood vessels, and it enters the abdomen through the diaphragm to supply the stomach and other structures in the abdomen. So this is the vagus nerve. So this both cross the superior mediastinum. Here, the vagus nerve continues in the posterior mediastinum. And there's a main branch here, the recurrent laryngeal nerve. So on the left side, it crosses from below the aortic arch. But on the right side, picture. Here. So here, this is the vagus nerve. On the left side, the left recurrent laryngeal nerve crosses more medially below the arch of the aorta. But on the right side, it crosses below the subclavian artery here. So this doesn't enter the superior mediastinum, the right recurrent laryngeal nerve, but the left one can enters the superior mediastinum. And pathology of the superior mediastinum, for example, if there's a lymph node expansion, like if there's a lung cancer and it causes lymph nodes to enlarge in this area, it may compress on this recurrent laryngeal nerve and it can cause a hoarse voice. The voice will change if that happens. Okay. So this is a cross section at the T3 level, that is above the demarcation of the superior mediastinum. So it's in the superior mediastinum. You can see the division. The superior vena cava has divided into the left brachiocephalic and the right brachiocephalic veins, and the three main branches of the aorta. Here the brachiocephalic trunk, left common carotid, and left subclavian. Then here you see the trachea, and posteriorly the esophagus, and here the thoracic duct. And you can see the veins, the vagus nerves, the left recurrent laryngeal nerve, and you can see there is no right recurrent laryngeal nerve in the superior mediastinum. Then here are the phrenic nerves, and here you can see the thymus. So this is the a CT view. So when you look at a CT, it's usually from the lower end of the body, right? So usually we look at the person from the foot end, right? So this is the foot end. CT pictures are taken from the lower end of the, from the foot end to the head end. So that way, this is the left side and this is the right side, right? So this shows the same structures. Here you have the brachiocephalic trunk, the left common carotid, left subclavian, the three branches of the aorta. You have the brachiocephalic veins, these two. Then in black color, you have the trachea, which carries air. And then from posteriorly, you have the esophagus. Right? So these are the lung fields and the vertebrae. So when you look at the posterior mediastinum, you have already seen you have the esophagus, the thoracic aorta, and then more posteriorly you have the thoracic duct and associated lymph nodes. And there's a system of veins called the azygous system. This is the azygous system, which drains the structures of the thorax, the thoracic wall, and other structures of the thorax like the esophagus, right? Here again you can see the thoracic duct. Then on either side of the vertebral bodies, you have the sympathetic trunks. If you remember the lecture on the nervous system, you can remember from the spinal canal, you had a sympathetic outflow, which formed two trunks on either side of the vertebral canal like this. So this is the sympathetic trunk. Right? So this shows branches of the thoracic aorta to the thoracic wall, and there are some mediastinal branches and esophageal branches. Then anterior mediastinum is a very small space. There are some ligaments here attaching the pericardium to the sternum. These are called sternopericardial ligaments. Then, as we told in the superior mediastinum, a portion of the thymus can extend into the anterior mediastinum. Then you have other fat connective tissue, and you can have a few lymph nodes. So that's the anterior mediastinum between the pericardium and the sternum. Okay. So a bit of activity for you. Can someone tell me what this structure is? This one and this one. They are both the same on either side. Yes, brachiocephalic vein. The superior vena cava has divided into the brachiocephalic veins. Then this one. Yes, the brachiocephalic trunk, right? Then this, the left common carotid, right? So this is the left side of the body. This is the left common carotid. And this one, left subclavian, exactly. Okay, so then what about this black color area? Trachea, and posterior to the trachea, esophagus. And here this is the spinal cord, and these are the lungs, right? So what level do you think this is? Yes, about T2, T3 level. That is about the T4 level, right? Okay, so here you can see the common carotid. Sorry. So the brachiocephalic trunk has already divided into two branches. So this is the common carotid, the right common carotid and the right subclavian. Left common carotid, left subclavian, the true brachiocephalic veins. You have the trachea, the esophagus. Yes, and the lungs, right? So this is at T2 level, right? So the subclavian, the brachiocephalic trunk has already divided into the right subclavian and the right common carotid here. Okay. What about this? What's this? This is actually the aortic arch. Right? This is the aortic arch. This I'm sure you can identify. What is this? Trachea. Yes, very good. And this is the superior vena cava, and this is the esophagus. And here you have the lung fields. This is at the level of, can you guess? Yes, exactly T4, because you have the arch of aorta beginning here. And the superior vena cava has not divided into its branches yet. Yes, this is the aortic arch, trachea, esophagus, superior vena cava. Yeah, and the anterior mediastinal tract is there. And here, let's start with the easy ones you already know. This is the what's this? Trachea, good. Okay. Then can you guess what this is? Bit difficult. What is this? It starts from the heart and enters the lungs. Blood supply from the heart to the, yes, the pulmonary arteries. Then, okay. this one. Considering its color, what do you think? Bronchus, yes, exactly, good. So here, look at the other structures. Okay, so we have the trachea here. Behind it, we have the esophagus, once you already know about. Then here you have the pulmonary trunk and the pulmonary arteries. Then here you have the ascending aorta, right? And here you have the descending aorta. And this is the superior vena cava. Then from the trachea you have the right main bronchus here. And these are smaller pulmonary veins. And these are the lung fields. Okay, can you... Okay, so this must be a level below the T4 level, right? Because you have the ascending and descending aorta both. So this is actually a cross section at the T6 level. Okay, what about this? Can you guess what this is? What's this one? Descending aorta, good. Okay, so can you guess what this is? This area? Okay, so this is the left side of the body and this is the right side. That makes this what? Oh, yes, exactly. This is the right ventricle and this is the left ventricle. You can see the wall is also more thin in the right ventricle here. And on the left side, the wall is much thicker because it pumps blood throughout the body. And the right ventricle, it only pumps blood to the lungs, right? So its wall is thinner and the left ventricle wall is much thicker. Right, so what are these? These shadows? What do you think? These are actually the diaphragms, right? So this is on the right side. This can actually, I'm not sure whether it can be considered as the liver, but yeah, these are shadows caused by the diaphragm. Yes, so here, right ventricle, left ventricle wall, of the left diaphragm. This is the descending aorta. And there is a small vein here. There is sinus vein on the posterior mediastinum here. Then you have the esophagus, a bit anterior to the descending aorta. Sorry, this is actually the liver, right? Very good. So below the diaphragm on the right side, you have the liver. So this is actually the liver. And here you have the right atrium. Again, the right ventricle cavity, and outside the heart, you have the pericardium. So this is much below, right? About T7 level, because you also have the liver, right? Okay. So in summary, you learned about the component parts of the thorax, and you were able to relate the knowledge of the anatomy of the thorax radiologically. Right? You can read more on the thorax, the recommended books for you. The Gray's anatomy gives a clear picture, a simple view of the thoracic anatomy, and you can watch this video in your spare time. It shows the cross-sectional anatomy of a CT of a thorax. So you can watch that video later. Okay, thank you.